Integrating wearable data into our patient analysis and reports, you got to be careful not to get bogged down by all the noise, which is most of it. Concentrating on the big metrics, the big things that we're using these tools for. For sleep, how regular is somebody's sleep and how much sleep are they getting? These are by far the biggest tools of anything. Of course, it's going to tell us our REM sleep and our deep sleep and all these other metrics, which can be useful, especially if you're waking up and you're not refreshed. Maybe we're getting some signal there. But there is no bigger tool in our kit than going to bed at a regular time and getting enough sleep. We can dial down from there and see how somebody's sleeping, how their heart rate variability looks on average every morning. I don't really care what somebody's HRV is day after day after day, but looking on a scale of a month, watching it improve as we do some new therapies for sleep or as somebody gets more fit, it's just reinforcing what we already know anyways. Keeping it simple, those are the big things that I'm looking at. And then for activity, I really like step count. As a lot of people though don't get all their movement and exercise through walking, running, or whatever, and nothing that gets recorded as a step. So daily active calories is pretty good. I have noticed that most wearables will pretty drastically overestimate the amount of daily calories that you burn, but you can get an idea of if it's continuously 700, 800, probably doing all right. Those are important ones. Also logging workouts, then you can quickly glance over how many times somebody's doing strength training per week, how many cardiovascular training sessions they're getting. We keep it high level, have the data to be able to be viewed over the period of weeks or a month, so you just see more trends and get some of that noise out of there, and then just those core sleep metrics. Introducing data into our process is interesting because it lands different on people quite significantly. Some people will just completely fixate on the data and it will drive them crazy, and that is not what we're looking for. We use data to look at macro trends to try to see what's going on. These are guideposts. These are not endpoints, and we can't over fixate on them. But they can point us in the right direction. If somebody's having problems with energy and sleep, and we're able to see that they get no deep sleep, no REM sleep at all, maybe we're a little bit more suspicious that there's some type of sleep apnea or some other issue that's driving this that we need to go look deeper at. When we use wearables to see what our heart rate is while we're exercising, when we're in zone 2. Dr. Greer told me my zone 2 is at 132 and I'm at 130. I better, move it up 2 beats. No, like your heart rate for zone 2 is somewhere in that general vicinity. And it was 132 when I tested you in our office, but today it might be 125. And so I want them to know that level of intensity is more of a feeling. That is the most accurate way to determine if they're in zone 2. But most people don't know how to do that right off the bat. So if I give them a heart rate range and then they start to pay attention that, oh, this is what I feel like in this zone, well, now I've won, and you can kind of drop the minute-to-minute watching of your heart rate, right? That's what we're trying to get. We're trying to use data as tools to show us how to implement this stuff right, and hopefully not have to worry about them after that. So we're going to get a lot more data on our body instantaneously. Is it going to provide a huge amount of benefit? Well, I think it will in certain cases when that data right then is going to be super useful and life-saving. I don't think it's going to change the fundamentals of what we do, of what we need to do for good health. You still got to move a lot and still got to eat right. And so maybe these tools will help us understand that a little bit more clearly, a little bit faster. But I think, again, we're probably going to be adding even more noise for people to go crazy about, honestly. That being said, I do love the idea of continuous lactate monitoring for a brief period of time, while somebody is exercising, while we're testing some protocol. But other than that, I don't think we need that. That's going to be a whole bunch of extra stress. Your lactate's up for no reason. Well, you're going to get super stressed out, and lactate might go up even higher than that. So I don't think we did anybody any good. Probably on the whole will be a lot more noise, but there's going to be some useful interventions and useful applications for it. I get to design the perfect longevity wearable. It would just be one piece. I don't know if the physics works, but it would, like right now I'm wearing a Garmin watch and an Oura Ring because I don't like to wear the Garmin watch to sleep because it's so big, but I love it because the sensors are better and I trust it with my heart rate while I'm working out. The ring I wear for sleep. This tracks my sleep way better than my Garmin would, and it's just a better profile for that. And it serves as my wedding ring, so it's a pretty good combination. The ability to have chest strap accuracy for your heart rate, so that you can use it to determine, if you're in your proper workout zones. Something that serves the function of an Oura Ring to be able to measure all those elements of your sleep. If it had an insert that allowed you to monitor your glucose for 10 days, right? I think that would be a great addition. Might as well use the same sensor mechanism to be able to determine lactate as you're using this to determine the intensities of your workouts and how much recovery time you need. I think that would be a great addition. I would also like it if I could speak to it and an AI was integrated into it as well. What else? I don't know. That's it. Yeah.